Good afternoon, everyone. Thank you once again for joining us, coming to you live from Henry Mayo Newhall Hospital here in Santa Clarita. We welcome your questions. Please continue to provide questions related to our services here at the hospital, as well as any general concerns or questions you have regarding COVID-19. So with that, you've probably seen a lot in the media recently regarding COVID-19, the fact that there are a number of states that are having surges. There are what are identified as hotspots within various cities around the country, that sort of thing. We're also hearing that some areas are having some difficulty with PPE once again. We remember weeks, months ago when that was a great concern, and we're starting to hear of those issues around the country as well. Here at Henry Mayo, just to give you a sense of what's happening in our community, our census for the most part with COVID patients continue to be pretty flat. We're averaging less than 15 COVID patients in the hospital currently. And the other significance is that the patients are not as ill. For example, we don't have near the number of patients that are on mechanical ventilation. We don't see as many critical patients, but we have a pretty small census, and it's been stable for about 2 weeks. As far as PPE, pleased to report Henry Mayo continues to be well supplied with the appropriate PPE, and there are no concerns in that regard as well. So we are seeing additional cases of COVID positive in the community, directly related to the number of COVID-19 tests that are being done in the community. We're now at various sites around Santa Clarita where testing is being done. There are thousands of COVID tests being done. So with that, you would expect that we would see more positive COVID results. So again, directly related to the number of tests that are being done. We continue to focus here at the hospital related to making sure that we're safe for patients when they come to our hospital. And today I have joining me one of our clinicians. Her name is Amanda Patey, and she is clinical manager for the Center for Women and Newborns here at Henry Mayo.
Hi,
Welcome.
Thank you.
Thank you
me.
for joining today and speaking to our audience about the services that you provide. Amanda, could you give us an overview of what are the services available regarding the center that you're responsible for here at Henry Mayo?
Well, we do have our new tower, and we provide 7 labor and delivery suites, and we have 22 private postpartum rooms, and we have our own C-section suite. So we are kind of a self-contained unit to provide really great care for our moms and babies. We also have an 11-bed NICU, which we can take babies as little as 23 weeks up to term for any needs that they have. And we're very lucky to have private rooms in our NICU as well.
Yeah, the new tower, that floor is gorgeous.
It's beautiful.
It's
Yes.
beautifully furnished. All the latest equipment
Yes.
is available, and we hear a lot of positive feedback from our moms when they deliver at our hospital. We get great feedback. The nurses specially trained, the physicians available, full service.
Yes,
So
our team is great.
we're very fortunate to have that new unit in place at our hospital.
Yeah.
We talked here on Facebook Live about safety measures that are in place in various areas in the hospital. We've talked about what it's like to come to the emergency room, that sort of thing. Could you give us a sense of what's been put in place in your department in order to ensure that our patients are safe and our physicians and employees are safe during this time of COVID-19?
Yeah, this is something we're reevaluating, I would say, daily. As a team, just overseeing maternal child health, we evaluate daily the director, Lori, and myself, how we can protect our patients better, how we can protect our staff better. We are very lucky, like you said, to have PPE available to us for all of our staff. Everybody in the hospital is wearing a mask, visitors, patients, and the staff. We are fortunate that we have the manpower to screen everybody who comes in the hospital, so all of the staff taking care of you are screened. We're constantly assessing to make sure everybody is healthy and safe to take care of you. We're making sure anyone walking through the hospital doors does not have a fever. We're doing touchless temperature checks. And we are providing screening for our patients that are having elective and scheduled inductions and C-sections. So what that looks like is 3 to 5 days in advance, we go to an outpatient testing center where they're tested for COVID, and then we do follow-up phone calls. So 24 and 48 hours before, as the window starts to close closer to delivery, we're screening them again. So, you can't always expect and plan to have a baby on a certain date and time, but we are taking as many precautions as we can.
Right.
Yeah.
That is great. It sounds like you have a number of steps in place prior to check-ins, that sort of thing. We've heard feedback from the community, of course. We know visitors are very important to patients when they're in the hospital. Yes. Having a baby is a very special time.
Of course.
And could you speak to what have we done to accommodate at least having someone to support that mom?
Yes, we continue to let one support person to be there with the mom for the delivery experience. They can stay with you through your postpartum stay. And if a question I get frequently from our COVID email at Henry Mayo is, can my support person leave to take care of my other children and then come back to be with me? And we do allow that. That support person, if they need to step out, of course, they can come back to be with you. It is really important through the whole antepartum and postpartum phase to have that person with you.
Right. Okay, very good. So there are accommodations made to ensure that.
And since it's all private rooms, they have their own pull-out bed to sleep in as well.
Very nice. So they can stay a while.
Yes,
they have to leave
can.
and come back. They can return.
Absolutely.
Okay, that's great. Very, very important consideration. Just further comments about visitation. Again, we do receive quite a bit of feedback in that regard. We are continuing to track what the trend is in the various communities related to visitors. Of course, we follow CDC guidelines here at the hospital as well as our county health department. So we're pretty much compelled to be consistent with those guidelines and practices. And as soon as we're able to make modifications to visitors and extending those visiting times, perhaps to other areas, we would like to do that as soon as we can, but in the interest of ensuring safety and making sure that everyone has a minimal risk of contracting COVID. We're just really staying on the side of caution at this point and following those guidelines. So I'm really happy to at some point be able to report we're going to loosen those requirements up. But in the meantime, we'll keep you posted on any changes. There are alternatives, Amanda, to having a baby outside of the hospital. We know that there have been instances reported where things don't go as planned. Hopefully everybody will have a delivery that's on course, that's safe, that sort of thing. But there are times that the unpredictable enters into the picture. Tell us a little bit about what is the advantage and why would you come to the hospital to have your baby? What kinds of things are in place to deal with the unexpected?
Yes, as a former NICU nurse myself, I can really speak to the fact that one of the most important things when you're having a baby is knowing that you have people in place to take care of yourself when you're in the delivery process if something unplanned or unanticipated happens. And here we have specially trained nurses and physicians that can act in these emergency situations to give you the best care or possibly prevent it because of the monitoring that we can do. The other side of that is making sure your baby has a specially trained, dedicated team of people just for them, and we can provide that care as well. And those minutes and seconds in these emergency unplanned situations matter, and I think it's really important to be physically here in the hospital so those needs can be anticipated and can be served right away.
Right, and then you did mention that we have a neonatal intensive care
Yes,
unit. So
we do.
right here in the hospital,
We do.
no need per se to transfer out. We can
Right.
provide that care for the babies that require that intensive care need.
We do. We have an amazing team with great physicians and trained nurses, and I think it's a really exceptional unit.
Oh, fantastic. And just to emphasize, we have an incredible team here that Amanda works with physicians and nurses. Lots of positive feedback about the experiences. So that's how we know best that the team's doing a good job. Our patients let us know that.
We're proud of the care that we give.
Very, very well. So we're coming to the end of our time today. Just like to have Amanda reflect on anything addition she'd like to share with our audience before we go off the air for today.
We just want you to know here at Henry Mayo that you are our priority and you're always safe in our care.
Excellent. Again, thank you, Amanda Patey, for joining us today.
Sure,
Amanda is the clinical manager for the Center for Women's and Newborns here at Henry Mayo Newhall Hospital. And we look forward to serving you, whether you need to come in to have a baby, visit our emergency department, or any of the other many services that we provide. We welcome you. Things are prepared for your safety, for the safety of our employees, and we look forward to serving you as the need arises. At this time, we're going to say farewell for now. Be safe out there, and please tune in next week.